Hi Marcus, my name is Andy. I'm the clinical pharmacist following up on your recent visit to review your care plan. Before we begin, can you confirm your name and date of birth? Alrighty, at your last visit, your main concern was getting your blood sugars under control so you can keep your CDL. Your A1C is at 9.2 and our goal is under 7%. That number reflects your average blood sugars over the past 3 months. We don't need insulin right now, but we do need to intensify therapy to prevent complications and keep us from getting to that point. First, I'd like to switch your metformin to the extended release version. You'll take 2 1,000 milligram tablets with your evening meal. It works the same, but is gentler on your stomach and should reduce the diarrhea. Second, I'd like to stop pioglitazone. It can cause weight gain and swelling, and we now have just better medication options that improve blood sugar and provide heart protection. I'd like to start Ribelsis, a once daily GLP tablet. You'll take 3 milligrams every morning on an empty stomach with a small amount of water and increase to 7 milligrams after 1 month, assuming everything goes well. This medication lowers blood sugar, reduces appetite, helps with weight loss, and has heart benefits, which is important given your risk factors. To improve monitoring, I recommend starting a Dexcom G7 continuous glucose monitor. It lasts 10 days and allows you to see your blood sugar in real time without finger sticks. This helps us see patterns and makes better adjustments. Your fasting goal is under 130, and 1 to 2 hours after meals is under 180. If you drop below 70, that's considered low. Treat it with 15 grams of fast-acting sugars. Glucose tablets are ideal because they work quickly and are predictable. Now I want to spend a little time on complication prevention. Diabetes can cause damage to small blood vessels and nerves over time. In your feet, that can mean numbness and reduced sensation. If you step on something or develop a wound, you might not feel it, and infections can progress quickly. That's why I referred you to podiatry. They'll evaluate your toenail infection, check circulation, assess nerve function, make sure that there's no early ulcers forming. Between now and then, check your feet daily and moisturize them, but avoid putting lotion between the toes to prevent fungal growth. I also referred you to an ophthalmologist. High blood sugars can cause tiny blood vessels in your eyes to get damaged. Early stages often have no symptoms, but if it's allowed to progress, you can lose your vision, which is why it's really important that we get you in every year. For your blood pressure, your last reading was 142/88. Since I only have the one reading, we'll increase lisinopril to 40 milligrams and recheck in 2 weeks with labs to ensure that everything's looking good. Lowering your blood pressure can help protect your heart, your kidney, and your eyes. For cholesterol, because you have diabetes, smoke, and have strong family history, your LDL goal is under 70. We're going to increase your atorvastatin to 80 milligrams for better protection, trying to get you to that goal. I recommend stopping your aspirin since you haven't had a heart attack or stroke, and in your case, the bleeding risk is likely outweighing the benefit. We're going to keep you on your gabapentin the same for now since it's helping with your nerve pain. It can be contributing to fatigue, but first I'd like to see if by just improving your blood sugars and by you using your CPAP machine more, if we can kind of get those energy levels up. Most important lifestyle change we can make right now is to quit smoking. If you're ready, we can start varenicline to help reduce cravings, but even if you're not, just if we can try and reduce the amount that you smoke a day, that can also begin helping. For diet, we want to aim for 3 smaller meals a day to prevent large blood sugar swings. Continue choosing salads and sandwiches when possible. We want to keep doing fruits over chips and candy for snacks. You don't have to cut them out entirely, but more often than not, try and do fruits. For exercise, we want to get you to do 150 minutes per week. This can even look as simple as taking 10-minute little walks on your rest breaks when you're on your drives. That can really kind of add up. We're going to follow up in 2 weeks for some labs and to get your blood pressure. This is going to be making sure that your lisinopril is looking safe and everything's good there. In 4 weeks, we're going to follow up and make sure we can increase that ribelsis, as well as get another blood draw to see how that increased atorvastatin is looking. And in 3 months, we're going to look at your A1C, see if all of these changes are helping. I know that was a lot of information. I'm going to provide a written medication list and summary. What questions can I answer for you?